obviously it's the gene therapy, I think, which is a potential game changer. Right now, unfortunately, the access is in developed countries, and high-income countries. So I'm very excited about that, because if it shows it's safe and effective, right, and it needs to be studied long-term, it will really change how we think about sickle cell disease management and access, sickle cell disease management, and it will change the potential outlook of a child who's born with sickle cell disease, and as they think about their future, that can significantly change what they can do. We've experienced it because we have also performed gene therapy at our hospital in Washington, D.C., and we've seen the impact that is made in a patient that's already received this. The concern, obviously, is the cost of this gene therapy, and we are concerned about that, and hopefully over time the costs will come down. And that's what we are concerned about, especially in low, middle income countries, because that's where the greatest burden is, especially in sub-Saharan Africa. So we would like to improve the access of these curative therapies, most notably gene therapy, because the gene therapy, you don't need a bone marrow transplant donor. It's done. They use your own stem cells. You're not dependent on someone else on that. But I also don't want it to overshadow the need for disease-modifying therapy access, because gene therapy at this time, at this moment, is going to go to is more likely to go to the severe patients. But as the technology is improved, I do believe that the access to these curative-like therapies will go to low, middle-income countries. And we just hope that it's done in a safe way. And also the monitoring after the transplant, after the gene therapy, is established wherever the therapy is offered, because that's something you have to do long-term follow-up, make sure there's no long-term effects from a health standpoint for the sickle cell patient. But yeah, we're very excited. In the United States, we're reviewing it December 8th and 20th, 2 gene therapy options that's coming up that the FDA will review for potential treatment option for sickle cell patients in the United States.